Major funding for NCMTV New California Media is provided by a generous gift from the James Irvine Foundation and the Ford Foundation.
Coming up on NCMTV, guess who's picking the food for your meals? Some of the unhealthiest people in America. They're California's agricultural workers. And now a new study says they're suffering in silence. That's next on NCMTV, New California Media, the new America now. No one cares about race anymore?
It's all about black people.
It's impossible to define what an Asian American film is.
They view us as some exotic creatures. Culture and identity is the issue.
We're in this together.
We are intertwined.
Lift our race.
We call ourselves the New California Media. Hello and welcome. I'm Emil Guillermo, author, columnist, and your host of NCMTV, New California Media. The census predicts minorities will be the majority in the U.S. in the next 20 years. It's already happened in California, where whites have dipped below 50%. That's why our program is subtitled The New America Now. This is your program for the news and views of the nation's emerging new majority. And now for our focus. Over 40 years ago, Edward R. Murrow shocked the nation with The Harvest of Shame, a documentary that followed America's migrant workers from Indiana to Florida. One image, a 29-year-old African-American mother of 14 who earned $1 a day in the fields. If Murrow was around today, he'd have to look at California with its $26 billion ag business that produces 40% of all the fruits and vegetables of the nation. The backbone of the industry remains its 700,000 farm workers. And that's where Murrow would find some more changes. True to the latest census, the laborers are mostly Hispanic. They're males in their 30s. And they make less than $10,000 a year. And now, after a new study, the first of its kind, we know one more thing. Their health habits and lack of insurance is threatening to become a major problem in California. Combing the lush farm areas of the state, the California Institute for Rural Studies surveyed and gave health screenings to almost 1,000 randomly selected farm workers from the Oregon border through the Central Valley to the Imperial Valley of the Southland. Now in bilingual meetings, the Institute has released the findings to community groups like this one, to a Mixteco group in Fresno. What researchers revealed was the exact opposite of a picture of health. Nearly 1 in 5 males suffered from high serum cholesterol and high blood pressure, the two leading risk factors for chronic diabetes and heart disease. Project head Don Villarejo says it's due to improper nutrition, bad health habits, and overall conditions of poverty.
Unless those things are addressed in a serious way, health education, getting guys in to get screened, get health treatments and so forth, we're going to have a major crisis on our hands in the future.
And you're talking about, well, not just because they're the laborers, but just a general health crisis among people in California.
Yeah, where are you going to put 100,000 diabetics 20 years from now? Who's going to take care of them? Where are you going to put 150,000 people with heart disease in this population? We have not addressed this issue, and the sad thing is that these things can be prevented.
La cintura, she hurt her back working in aspergillus.
Beatriz Cordova interviewed workers for the project.
A lot of the ones that I did had no papers and no health insurance. And of course, with no papers, you can't get health insurance, you can't get benefits. So basically, that was my problem with my interviews that I performed.
But it seems like they were more scared about because of their immigration status. They didn't care about their health.
No.
And so a lot of them were sick.
A lot of them were sick. The ones that I did that did go in, I explained to them, you know, the procedures, and a lot of the ones that I did that did go in were very sick. High cholesterol, some were diabetics. But yes, they were sick. But to them, and so, not the majority of them, but the ones that some of them did not have any health insurance, and they didn't want to, you know, they said it was too expensive to pay. So they just decided not to go in.
Money issues, more than the Immigration Service, was found to be the biggest barrier to good health. Nearly 70% of all farm workers interviewed lacked any health insurance. Only 7% were covered by any government program. While 16.5% said their employer offered an insurance plan, nearly a third said they couldn't afford the premiums or the copays. It results in these startling numbers. 50% of the farm workers had never been to a dentist, and 32% of the men said they had never been to a doctor
in their lives, even if they were ill. More often than not, it takes a major accident to get a worker to a doctor. On this day, a van filled with workers smashed into a flatbed carrying a forklift. The driver and a passenger were seriously injured. But most who get hurt in the fields never bothered to see doctors. Andres Magana is a 60-year-old field worker who drives a tractor. Magana says health care is just too expensive. No one can afford to take off from work. The biggest fear is getting fired, so workers work through illness and injury. Magana lives in Fireball, a small valley community near Fresno that once served as an entertainment spot on the San Joaquin River. Nearly half of the survey's respondents were from Fireball.
What milligram do you think I should watch my sugar until they get it down to what?
Probably into 5.
5?
Yeah, because 5 is just about what your body makes. You know, then they're going to be tapering you down from that. So somewhere close to 5, you've got to be really, really careful.
Marcia Sablon is the town doctor. Don't let her busy waiting room fool you.
Well, that's only a very small percentage of people. You know, there's 3 doctors here and we have 3 part-time nurse practitioners. And to serve the health needs of a large area, underserved, people that are still catching up with their health care. Big problem, of course, is a lot of patients have no third-party payer, and they're probably are not able to access other types of clinics, other types of health care. We have probably a third of our patients that don't have any third-party payer.
So what does that mean to someone like yourself, a provider? Do you get paid?
Well, sometimes we do, and sometimes we don't. It's something that we decide to take on and to work with. The good thing that we have is that we have unlimited demand, so we can always make up for anything that we would lose in a different area by the demand for our medical care.
So health is a loss leader, huh?
Right. The hard part of that whole situation is the medications. And hospitalizations. When that same person, it's easy to take care of a person with a cold with no third-party payer, but when that farm worker, has diabetes, high blood pressure, and looking at $100 or $200 worth of medicines every month with no third-party payer, then that's where the problems come in.
And the problems Dr. Sablon says her crew see every day are deadly.
The 2 things that are killing our patients here are the diabetes, the effects of diabetes, the long term. We just had last week one of our patients, a 50-year-old man, die of renal failure with diabetes, and that shouldn't happen anymore in the year 2000. We have kids.
And why does it happen?
It happened. That man had no third-party payer. He worked as a truck driver with no insurance for the longest time. He took medicines every once in a while. He went to the doctor every once in a while until his kidneys failed, and then he was on 100% Medi-Cal, 100% Medicare, and also on renal dialysis.
It was too late.
Too late. Too late.
Dead at 50?
50.
Is that normal?
Of course not. Of course not, but we see that. That's not the first patient. We can name you a list of people that have died from diabetes complications. Same thing with asthma. Asthma is a very treatable, maybe not preventable as we understand right now, but treatable. We see people that die from asthma.
Unlike eating fruits and vegetables, picking them has clearly been detrimental to one's health. Now armed with information, researchers hope the survey's findings will help drive new public policy for affordable health care for the men and women who work the fields.
There is this myth or this belief that farm workers come to California from Mexico and take away from our social services and our health services and take jobs away. And this is simply not true. The $30 billion a year industry in which they work and which rests on their backs, as a matter of fact, makes California the 6th richest entity in the world. And we owe that to the farm workers. So I think what really needs to change is the attitude of Californians in general towards these people who have come to work in our industries and in our economy.
So do we value the work of the farm laborers enough to heed the early warning signs? Or will the laborers continue to, as the study suggests, to suffer in silence. Let's meet our guest today. First, let's go to Don Villarejo. He's the former executive director of the California Institute for Rural Studies. He designed and managed the research project Suffering in Silence. Don, welcome to our program. Thanks for coming down from Davis.
Thank you, Emil.
Also, Dr. Marcia Sablon, a physician from the San Joaquin Valley community of Firebaugh. We got that former hot spot, but now it's a hot spot for a different reason. Not only one of the few health providers in the area, but also a former mayor and current town council member of Firebaugh. Thanks for coming up from the Valley.
Thank you, Emil.
Dr. Sablon. All right, so let's begin. We have a small little cozy gathering here of people who are intimately involved with this issue. And Don, let's begin with this study. It strikes me as odd that this is the first time something so comprehensive has been done on the farm workers.
Yeah, it is. It's a sad commentary, really, but it's actually a very difficult population to study. Most people come from Mexico or Central America. We found 92% of the workers we interviewed were from those countries. Many are migrants. Many are not literate, either in English or Spanish. Many are undocumented, are here without papers. And so it's a population that is really kind of trying to hide in some respect, particularly from government officials or anybody who's perceived as having some official capacity. So doing this work is actually very difficult, and that's part of the reason why it hadn't been done.
All right, but beforehand, there was only presumptions made about who was out there in the fields, and then this gives you some hard evidence. So
exactly.
Let's talk about some of these issues. First of all, this idea, it's not the idea of picking that's making people sick, or the farm labor itself making people sick, but it's a lot of different things. What is it? What is the single most thing that contributes to the poor health?
It's poverty. These are folks who earn between $7,500 and $10,000 a year. Try to live in an expensive place like California on that kind of income. Family incomes are typically $12,500 to $15,000. Try to support 4.8 or 5 people on that level of income. It can't be done and have health insurance. Most of the folks who work don't have health insurance through their employer, unlike, say, you or I or other people who are part of the normal economy. 70% did not have any form of health insurance.
So it becomes a kind of a cascading thing,
exactly.
Starting from the economic base. The poverty is there, and then that leads into poor nutrition and poor health habits. You don't want to go see a doctor, and then they're sick.
And also, I think there's a level of ignorance, frankly, among many poor people about proper diet, nutrition, and preventive health. If you're in a mode where really you're practicing what we call symptomatic medicine, only responding to conditions that are so serious that you have to deal with them, in many cases already it's too late. We interviewed one gentleman who had a toothache for a year and treated it by putting herbs around the tooth to deaden the pain. By the time he gets to a dentist, it's too late.
All right, let's turn to Dr. Sablon. You see the medical problems come up. I mean, this is no knock on your filing system. There's a lot of cases there. You have a lot of demand. But how do you assess, what's a general profile of the health of those farm workers from your perspective? Are men less healthy than women, for instance? Or?
Well, Emil, I would agree with Don that poverty is the basis of the problem, and the men are working. They're out there in the fields. Now, we know from our studies of men in other countries that men have heart problems at an earlier age than women do. So I think that's the emphasis that Don was making in this study, is that those chronic diseases will affect men earlier, while they're the least likely to have access to health insurance and to medical care.
Yeah, and a lot of the women, because of maternity and things like that, they see doctors, but the men, if they have no reason to see a doctor, they don't go. That must strike you as odd.
Right. And look at the programs that are available for a person that doesn't have health insurance. A lot of times we have CHDP programs for the children. We have
CHDP
is the Child Health and Disability Prevention. Every California child is eligible for free immunizations. That's taken care of. Family planning programs get in another whole group of ladies to have their annual exams, pap smears, birth control methods. Men, there's no programs for them. There's no program to prevent diabetes, to prevent heart disease. There's nothing available for them.
All right, and now you mentioned this idea of a man dying at age 50 of diabetes. I mean, that wouldn't be normal in an urban setting, would it?
No, that would be unheard of in a setting of a person that had adequate medical care.
And so, in some respects, this survey really uncovered or really brought these people out in the forefront. Now you know you have this real problem as opposed to an anecdotal
right. I'm hoping, and everybody else that works in the area, Emil, is hoping that this has brought people's attention. A lot of problem solving comes from people just being aware of things, and that's what I was so happy about the survey.
Yeah. Now, Don, to do the survey, you really had to, or you had interviewers like Beatrice, who was in the piece, go out there to where people lived, and this is once again speaks to the economics and the poverty, some of the places where people lived. Why don't you describe some of those places?
In order to do a survey of this kind, I began with what I consider to be the most fundamental principle of doing scientific research, and that is, if you're going to examine a population as a whole, you want every member of that population to have a chance of being included. And a long time ago, Ralph Santiago Abascal, one of the leading lights at California Rural Legal Assistance, he passed away a few years ago, once told me that the person who most needs the kind of help that his agency provided is the person who never makes it to the office. So we set out to deliberately find all of the hidden labor camps.
All right, and where did you find them? What kind of conditions were they living in?
Well, many people live in houses and apartments just as you and I do, except that they're rather modest houses by conventional standards. But many people also live in very unconventional settings. We found people living in sheds. We found people living in abandoned vehicles. We found people living in garages. We found 15 men jammed into a single trailer.
I mean, still. I mean, because the presumption by a lot of people, when you say, I notice you use in the report the term agricultural workers and farm workers interchangeably, but a lot of people would say, boy, you know, since the unionization movement with the Filipinos and Cesar Chavez and the Latinos in the 60s and 70s, maybe things have improved so much. Maybe Murrow would find a different kind of setting. But is that presumption correct? I mean,
well, I think there have been some major improvements. Farm workers are now covered by minimum wage, and it went up to 6.25 January 1 of this year. Thank goodness for the Industrial Welfare Commission. Farm workers are protected by workers' comp insurance. If they're injured on the job, medical care is provided, and they get indemnity if they lose work days, for example. There are other protections that are out there, but only about 1% of California farm workers are covered by union contracts today. That means that most workers are not covered or protected by those provisions. They do not have paid holidays. They do not have sick leave. They do not have health insurance. They do not have any kind of retirement.
And as you pointed out in the survey, even when it's afforded to them, they don't take it up.
Because they can't afford the co-payments.
All right, now one thing also you found is that the conditions in the fields themselves, and we were trying to make the distinction, what's killing these people? Not the act of picking or farm labor, but some of the conditions in the fields haven't improved that much.
Well, I think you should emphasize the fact that being outdoors, doing this kind of active labor in the fields of California is not by itself unhealthy. That is, what we see is active young people, many of them in very good health, doing hard physical labor. But there are risks associated with that, risks of injury doing stoop labor, an injury to your back, for example. Very common among this population.
All right, now there was also something with pesticides that you saw. There were actually, I mean, because that's a real fear when you're in the fields, but there was this sense that an anecdote that you came up with, that people were being treated as guinea pigs in a way.
Well, people feel that they're not being adequately protected. Most workers that you talk to about pesticides will say that they want more protection. What we found was that many workers that the law requires to have been trained and taught how to work safely with chemicals and be provided with protective equipment had not been trained at all. And that's unacceptable. California law requires that they be trained.
So some of those things did shock you somewhat,
Yes,
that it wasn't up to the kind of standard that you had.
And we still don't have toilets and clean water and wash water in the fields. It ought to be 100% every field.
What is it now?
We found about 80 to 85% compliance.
Oh. Well, Doctor, now, as you know, it must strike you somewhat ironic that, you know, in the state of California, that here are the people picking the healthiest things that people can ingest, and they're not so healthy.
Right. Emil, I think an important point that we need to talk about is why are these people sick? Like Don talked about, living in poverty, if they lived in Mexico, would they have the same level of disease as they have here? I don't think so. I think the difference is here we are in an industrial society where fast food is available to us. Things are available to us that are within the reach of a person in poverty, yet they don't know how to manage those things, and they don't have the resources to deal with the effects of eating that type of a diet.
So some of these things are brought on because of, well, once again, it goes to economics, to go to fast food.
And where they live.
Yeah.
They live in a society that has these things available, yet they don't have the means to deal with those things.
Now, you mentioned the lack of a third payer involved, or insurance, lack of insurance. Some of these people are migrants. Do they seek health care in Mexico, or have they ever seen a doctor in Mexico, and some of these migrants who are from there?
They do. In fact, some people are actually forced, Emil, to wait until their vacation time around Christmas to seek care for, as Don mentioned, for dental problems. That's the typical one, that people would suffer with tooth problems all year, waiting for Christmas time when they have 2 weeks off to go to Mexico, visit their family, and have their dental care done.
Mm-hmm. Now, Don, we mentioned Mexico. Dr. Sablan says, yeah, they look to Mexico. Vicente Fox, president of Mexico, was in California, talked about the agricultural workers. Does his administration bring some kind of hope to dealing with this problem?
I think so, both in terms of raising the profile of these issues. He's created at the level of his cabinet in Mexico, at the highest level of government, a Ministry of Migration now that is to address the issues of the millions of people who come to the United States and earn money, send much of it back home. That's very important to the Mexican economy. But the other thing that he's done that I'm at liberty now to talk about for the first time is that he's made now a commitment to train barefoot doctors, promotores de salud, health promoters that are working in the United States. He's already offered now to train those folks in Mexico. There are 40,000 health promoters, barefoot doctors in Mexico already.
Barefoot doctors, that's a term?
Well, they're intermediaries between a population and the healthcare system. They teach people good health habits, and they teach people how to access the system. In the United States, the way we do access for very poor people is we give them a pile of paper this big, 42 pages to participate in Healthy Families when we got started. It's in English. And how are folks supposed to deal with that? Well, you have to have a lot of intermediary help if you're someone who doesn't read or speak any English, and if you're working every day and you don't understand even some of the terms that are being used there. You need that kind of intermediary.
And this is part of that ongoing, I guess, if we were to identify one or two things that need to be done immediately, this is part of that outreach.
It's a part of that outreach, that health education, teaching people how to access the system, asking people, for example, we did a health promotores program in my organization about 8 years ago, went on for 4 years, a wonderful program. The promotores went around and visited families and asked, when was the last time Junior was at the dentist? Have you ever had an eye care checkup? Those kinds of questions, just to get people thinking about those issues and addressing them in their family.
All right, now, I guess one of the big issues, though, still remains this idea of, well, how do we get access to health care for these people, and how do we get insurance to these people? Because we know that the general population, we know that people of color have a hard time with access to health care and health insurance. Dr. Sablan, what would it take are these facts that we've presented today enough to get public policymakers to move more toward providing that kind of care?
Well, it certainly has gotten their attention. We've had 3 newspaper interviewers in Fireball, which have never been seen before over the last 2 weeks.
Well, yeah, when was the last time a New York Times person went to Fireball?
Last week.
Yes.
So it has gotten the attention. That's one thing. Now, can we keep the pressure up? Can we keep the demand up? Are the medical schools going to do something about the distribution of medical care in the area? You have to look at the market, too. If we had the market of these people with insurances, would doctors move to their areas to work with these people? Those are all the different factors that go into it. It's on both ends.
Right. I mean, so there's other ways besides saying, okay, we're going to make the insurance companies come up with something low cost and affordable, but there's all sorts of ways to address this problem, from the medical schools to the communities on down. Right. But is there one thing in particular, Don, that could be done immediately that would increase the health of this population?
It's actually a complex problem, as Marcia was indicating, and the California Endowment, the foundation that sponsored the survey, continues to have a very strong interest in this area. They've made it a high priority for this year in their work. They created a task force of 24 very knowledgeable people, including Dr. Sablan, to look at all of the issues, and came up with 25 recommendations. Among them, a better distribution of providers. But how do you make that happen? Among the recommendations were providing health insurance. But how do you make that actually work? A whole set of ideas.
But no infrastructure yet, no mechanism to put it in place?
Well, happily there were 4 members of the California legislature on the task force as well, and including both chairs of the Senate and Assembly health committees. And they have a very strong interest and a commitment to working on this issue. I was on the task force as well. We're going to continue to work with the legislature and with the federal government to try to leverage the investment that the California Endowment will be making this year. They have committed $50 million at the endowment for new grants to address this issue. We'd like to leverage that into health insurance, to better access to physicians, and so forth.
Well, Dr. Saban, not only are you the town doctor in Firebaugh, but you were also the former mayor, and now you're still a city council member. Has information like this politicized the farm workers so that maybe we might see this issue come up more in some of the state races in the future?
Oh, I'm sure we will. You know, that the census alone, like you mentioned in the beginning, mentioned that the Hispanics now have a voting power that they didn't have before. We should all be ashamed of this problem, and I think the legislature, Dean Flores, several of them have already given speeches promising their help and their direction to the California Endowment seed money.
Now, one of the ideas about that Bonnie Bade mentioned in our piece, that it's the attitude of Californians in general. And with 187, Prop 187, there was this fear that maybe that undocumented workers were taking away from the services. We may face an economic downturn. What do you see might change some of the attitudes that we saw in 187?
I don't see a whole lot of high school graduates from the Bay Area running out to the fields to go pick grapes or other commodities. It's not going to happen. No young person born here today wants to do stoop labor as their career goal in life. We have a real serious problem in that. In other words, we have a huge industry, 3 times bigger than the motion picture industry, actually, in terms of its revenue. And yet we can't find people in this country who are willing to do that work. So we're going to Mexico to get those folks.
But if things go nativist, you know, in an economic downturn, where's the hope you see in the future?
Well, we tried that a number of years ago. Not only was 187 found unconstitutional, we did all kinds of goofy things which have now been thrown out by the courts because they didn't work. And we have some consequences of that still happening today. A person who doesn't have documents in this country is not able to get a driver's license in California. Now that's goofy. You know, we'd like to have people with driver's licenses.
We just have about 20 seconds left, and I want to just ask a final question. If we don't heed these early warning signs, what's at stake, Dr. Saban?
It's the medical care system of California taking care of these sick, disabled workers. They're here. We're going to take care of them. Should we take care of them and prevent their illnesses, or should we wait until they have renal failure?
And Don, 10 seconds to you. Final word.
I think that we have an opportunity to be the leaders in the nation in addressing the problem of the uninsured and the folks who work in the fields to make us healthy.
All right, Don Villarejo, Dr. Marcia Saban, thank you again, and thanks to you at home for watching. At NCM, we appreciate your feedback. Email us at ncm@amok.com. You can read my columns at www.amok.com or call us toll-free at 1-888-440-3645. For the best in ethnic media, go to www.ncmonline.com. I'm Emil Guillermo. Thanks for watching The New America Now. We're NCM TV, New California Media.
Major funding for NCM TV New California Media is provided by a generous gift from the James Irvine Foundation and the Ford Foundation.